The majority of Australians, answering the phone, washing the dishes and cleaning the house are the simplest chores of the day-to-day routine. But for chronic pain sufferers, they can be anything but, and everyday household movements can rapidly divulge into incapacitating bouts of pain.
I had children young and I had chronic pain then in my back. I couldn't pick up any of their toys after being playing with them. I'd had to wait until my husband came home.
Lynn Beckenham, from the leafy streets of Lang Cove in Sydney's North Shore, knows all too well this painful narrative. Lynn has not only suffered from recurring back pain for the best part of 30 years, but has also been on the other side, treating countless patients with the condition over her 40 years as a doctor. And from both sides, she has seen numerous ways of treating the pain.
In those days, and it's not used as much now, but an antidepressant of the old tricyclic antidepressants, pethidine or morphine or whatever it was written up as injections, mild anticonvulsant.
And by far the most common of these treatments is the use of opioids, better known as painkillers. A trend that continues despite a recent study by Harvard Medical School showing that opioids are overprescribed and ineffective in treating chronic pain. Dr. Erin Crumlin, a doctor at Mackley Street Practice in Sydney, agrees with the study and is wary of prescribing opioids for chronic pain.
On a minor level, they cause quite severe constipation and sedation, and really they're very addictive.
As a pharmacist on the northern beaches of Sydney, Kathy Gray regularly serves customers who have been led down the path of opioid dependency by mismanagement of their chronic pain.
This one lady at the moment who's dying, but she's been put on opioids very early, and they actually had to put her in a detox unit to get her off the opioids, to get her on a proper pain management, because she was addicted to all the opioids. So quite often if you go just to a GP that is really overworked, they will stick them on quickly because they just don't have the follow-up. They should be your last line of treatment, because you should be going through a whole list of other things and alternative things as well before you get to the opioids.
A Northern Beaches resident, Christine Helen's ribs have been a source of persistent pain ever since she was involved in a traumatic car accident approximately a decade ago. However, Mrs. Helen has found tailoring a treatment to her own preferences somewhat alleviating of her discomfort.
So it was all a matter of trial and error, and it was my pain. So once I owned it and realised what worked best for me, I didn't like being on the opioids. They just didn't feel good. So yeah, I sort of steered away from those sort of doctors, the conventional line doctors, and yeah, stayed mainly with physiotherapy.
For Dr. Beckenham, this came in the form of exercise.
Long exercise, which was, you know, to really bump you up quite fast into being fitter. And I found the exercise almost the best treatment of all. And building up and doing bicycling, for instance, and the wonderful euphoria that it gave you, and being able to move faster.
Likewise, Dr. Crumlin sees it as integral to shape the form of pain management to each patient and believes medical practitioners should place more emphasis on the holistic care of the individual.
Most doctors are working on a 10-15 minute timetable per patient. You've got to get people's trust. You've got to engage in a plan. You've got to implement the plan. Not only that, but according to Dr. Crumlin, sufferers must be able to think positively about their future. If you can somehow engage them and give them confidence that that the treatment you're giving them is likely to work if they engage with psychological therapy as well. And the psychologists are very, very good at helping people overcome chronic pain.
It seems then, agreed upon by all involved in chronic pain, from those who experience the pain to those who treat it, that the way forward is through greater education by the wider medical community about the ailment.
I think that the more education there is for health professionals, the better. And that includes physiotherapists, occupational therapists, social workers, nurses, all health practitioners.
Matthew Page, UTS Journalism.